So I'd like to welcome you to this edition of Drop In and Learn. My name is David Toddington, and with me today is Chelsey Goodman. Chelsey is a microbiologist who has worked at Canada's National Microbiology Laboratory and has worked on actually standing up responses to pandemics in the past, such as H1N1, SARS, MERS, and also Ebola. So first of all, welcome Chelsey to coming in today to Drop In and Learn. And you and I had spoken a little while back when the global pandemic that we're now facing, COVID-19, was really just emerging. Now, we're recording this in mid-June. What have we learned? And it's interesting to me because COVID is getting, shall I say, it was swept under the rug just a little bit with other news stories that are taking precedence right now, but the problem still persists. So what is it we've learned? What is it that you've learned in this past few months as more data has become available?
Thanks for having me, Dave. Hi, all. I guess with COVID-19, it's really unprecedented what we have seen with respect to this global response and all of the different roles in this open system. We have volatile politics, social, economical, religious play, and that really contributed to rapid spread and unprecedented impact. So we've seen a lot of things happen that were maybe predicted from different subject matter experts, but now everybody's coming together and actually seeing how all of these things are playing together at once on a global level. With respect to the virus itself, it's very novel, very unprecedented what we've seen in humans, how the infectious disease goes through the body. And even to this day, we really do not know very much about this virus, yet we've been working on it around the clock for the last 6 months.
Take me back to SARS, and you worked on SARS as a microbiologist. What are the big differences? I mean, SARS, did it burn out? Did we eradicate it? It is no longer with us. It is no longer a threat. And yet COVID-19, the SARS-CoV-2 virus is still very much among us, and in many places it just continues to grow, and we're probably facing a second wave. What are the big differences? Why is SARS no longer with us? Why is COVID-19 still the threat it always has been?
From what I remember with SARS initially is that the people would get sick and they would start showing symptoms earlier than COVID-19. So the transmission was a lot lower, in a sense that you were able to more easily contact trace people who have been sick and who they have been exposed to in the last couple of days. Where you see COVID-19, people are shedding the virus and are symptomatic, and they're pretty much out and about for a good 7-day period where they're shedding the virus until they actually show symptoms. So contact tracing on such a large time scale like that is very difficult. And also, I think that there's a lot of travel that came into play with bringing this back and forth to first world countries, and it's a lot different than it was 10 years ago, that's for sure.
Now, tell me about contact tracing and the importance of that. I mean, people can be asymptomatic. We can see asymptomatic spread. There's been some conflicting news stories just in the last week. I think some things that were perhaps misinterpreted from the World Health Organization, indicating that maybe asymptomatic spread is not the issue, but I think there's been some backtracking on that, and it's still a problem. And what I'm getting at here is this interesting, what you're doing as a microbiologist, but what you're also doing as an investigator, how you're bringing in these data points, and then the process of contact tracing. How is that traditionally done right now? What do you see as areas where there could be some significant improvement in terms of contact tracing?
Well, before COVID hit, in the last tenure of my career as a microbiologist, technology has soared. We'd have epidemiologists that would be responsible for this contact tracing, and they use just regular tools of going out there physically with a paper survey, going into somebody's house saying, you know, what have you eaten, for instance, if it was a foodborne infectious illness, who have you been exposed to, have you had any big gatherings? So it would be pen, paper, on foot, going and putting it into a database, and then collaborating with other stakeholders. Nowadays, you see a huge push for technology and contact tracing, where we can even have an app on our cell phones that's coming out that can tell specific government agencies that are doing their contact tracing, if this person has contracted COVID-19, what other people with a cellular phone were in that vicinity at the time where this person was infectious. So the ability to contact trace is really getting a lot more efficient, but with that comes a lot of other caveats like privacy concerns.
Mm-hmm. The job of conducting an investigation, the role of critical thinking. When we take data, we group it together to get information, we contextualize it to get knowledge, and we want to act on knowledge. Having worked in public health, having worked on outbreaks in the past, what are some of the things that you took away in terms of how those investigations unfolded? What went right and what went wrong? In terms of when the data is coming in, how it's being interpreted, and trying to get to that point of knowledge. Tell me a little bit about that.
That's a loaded question, I guess. A lot of the different responses we worked on at the National Microbiology Laboratory, they were all different in their own way. When I started my academia, they just start you simply with basic research objectives, like give me a question. What's your question? What's your hypothesis? Methods, results, conclusions. So you learn how to ask the right questions and look for the answers. And then when you get a little bit better, you start adding variables. And so you get better at critical thinking while you're looking at the open system. And I think most discoveries involved a game-changing concept. So you can't access that creativity if you're not comfortable opening up yourself to the unknown, which is what we did a lot. And we really didn't learn a lot of true life lessons until we were thrown into real-time responses. So very different approaches when you're looking at different pathogens. So when I was in the National Microbiology Laboratory, we did lab-based surveillance, which was on foodborne diseases, and it was in real time. So we had to do a lot of critical thinking on the fly. People are getting sick all across the country with, you know, salmonella or cholera or E. coli, and we had to try and backtrack where the outbreak originated. So just opening up your eyes and learning about, you know, you learn about epidemiology in school, but really you're not the one out there with the paper and the pen and making those correlations. So sitting at the desk and trying to put all the pieces together, it was fascinating to see. You know, we had a hypothesis on, you know, where a foodborne outbreak originated, and we were completely wrong because there was 2 different outbreaks going on at the same time. And with bioinformatics and computer data being where it is now, and it's the functionality and the productivity that you get from all of these strands of sequences of DNA, and you could pump out results so quick, you could actually see these variables that I think we missed even 10 years ago, saying, no, there's 2 outbreaks going on at the same time, or why is there one outbreak going on somewhere else and then there's another one across the country? Well, you can follow a food distribution truck. We had another crazy case in the States where there was a bunch of children infected, and then they brought their infectious little dirty hands to the schools and infected more children with salmonella. And it turns out it was this guy on the street selling illegal turtles. So it's just really getting yourself into real-time exercises that brings the critical thinking to light, because it just gives you a whole different dynamic that you're not operating in a closed laboratory system. This is an open system with so many dynamics, and this is what we're seeing with COVID on a global level. There's just so much going on, from political, religious, economic repercussions that are changing the course of this.
And this leads me into another question that I wanted to ask you about that of cognitive biases. I'm always fascinated with an investigation, be it simple or complex, and how the cognitive biases that we all have to differing degrees sort of carry into that, how we see things. And one of the things that occurs to me is clustering illusion. When you talk about the fact that you've got all these different data points coming in, and we may see a pattern in something that it could be a completely random chain of events, or maybe not. What did you experience in working in the investigations, the public health investigations that you worked on in yourself and the people around you? What role did bias play in all of that? You've talked about the more mathematical processes where we may be able to look at things slightly differently, but did you find that bias played a part in that and maybe even took things down the wrong direction sometimes?
I think not so much from laboratory level, because I found that the people who I worked with were very high level critical thinkers. I do know that when you're investigating, your typical E. coli, salmonella, or any kind of pathogen, there's always some sort of pattern that the subject matter expert has read in manuscripts and different publications. So you're going to go off what's out there. But also, I find scientists they're real critical thinkers. They are very open-minded, and they don't just blindly accept information that's provided. They really open up their mind to new evidence, and then they detach their beliefs, and they're open to different constructive criticisms and new ideas when we all get together, which can be very hard sometimes. But at the same time, science and innovation and research and technology is always a moving target. It's always changing. There's always biases that we thought were one thing when we got new technology and bioinformatics that opened up a whole new world, and we realized we're a little bit off the mark. So it's just that moving target is it's pretty common in the science game. But I think it's a little less common in media, and especially in social media. So you can get really caught up on holding on to your bias and really trying to understand information, especially when it's medical, because people they're cognitively lazy. They want to come up with like the easiest answer that they can understand without being left in the dark. So, and they also want to feel a bit of sense of closure too, that they're going to be okay. And I feel that a lot of people feel very vulnerable. And so that's where I see a lot of biases out in the media.
So scientific methodology being applied effectively in the scientific community is what I'm hearing from you. And then we start to get into the infodemic, if you will, that accompanies
Yes.
the pandemic. What should people, the average member of the public, we only have so much capacity on a daily basis to take in the news. We have our own biases we may not be aware of as well. So we may go to particular news sources that we feel we trust, when in fact, it's just that news sources matches our own personal biases. We've seen the politicization of information as well. What should people be thinking about when they see information on COVID, and how should they be sort of processing that, if you will?
Well, a lot of information is coming through social media, with people sharing different posts and different news articles. I find that's a really big vector to get the news into someone's ear, because a lot of people are using social media on quite a high basis. Me, for instance, I'm guilty of it as well. I have Facebook, and I have a few friends on there, but I've added all the credible news sources I can. So at least when I'm going through, the fun social stuff in the morning, all the latest news pops up in the same feed. So it's really convenient. But what I found going through a lot of this stuff is make sure that you consider the source of where this information is coming from. You can look to see who published it. You can look them up to see if they're credible. I know that you have a bias chart, a media bias chart, Dave, that I really enjoy. It goes from far left political view media to far right, and then the other axis shows level of credibility and fact checking. So it just, you really have to do your research on stuff that's legitimate, coming from a legitimate source, or if it's just a clickbait, they're going to throw out like a really fancy headline and you're going to click on it and that's all they want. They want the views. So what is their agenda? Is it actually educating you, or is it political, or is it financial? Also check with official sources to cross-reference what you're reading. So with COVID, your local government websites, World Health Organization, CDC are all good places to go. And then, of course, check your own biases, like we've been talking about. And the biggest thing is don't share a post if you haven't read it, because you're spreading misinformation potentially that can cause like a giant wildstorm.
So think before you act is what it comes down to.
Yeah.
Yeah, and very often with critical thinking, one of the things that I like to say is be skeptical, don't be cynical. So ask the questions, think about your thinking while you're thinking it, and be very careful about what it is that you pass on.
Yeah, you have to ask yourself the right questions. If you don't, then I think that's our social responsibility with all of the information that's coming out at the level and the volume that it's coming out. Really, it's on us now to be able to parse and filter and curate what's coming into our brains.
Right. One of the things that you stated quite clearly is that we haven't seen anything like COVID-19 before. Going back 100 years, we had the Spanish flu. Now, when we look back on history and we try to sort of model and see if perhaps we're going to be into the second, third, and fourth wave, as was the case with Spanish flu, what are your feelings about that? Is there a valuable data that comes and lessons learned from the Spanish flu that we can apply to this, or is it something quite different? How do we reconcile all of that?
I think the general idea of subsequent waves for a global pandemic is true. We're going to see a second wave and we're going to see a third wave. I can't remember what the Spanish flu was, but I believe the third wave was the strongest. But the fact that we're going to see more of this and not less, and it's not just going to extinguish itself, is a valid argument. I do know the medical capabilities and the communications that were available in the 1900s aren't what they are today. So we are more efficient as a society in getting the message out and getting the right message out. But at the same time, people are just, they're inherently human and they're scared, they're getting tired, they're financially and politically questioning agendas. And it's just human nature to just do what you want to do and be able to do the right thing for your family. So I think that we're going to see a bit of a relaxed view with COVID, especially with what everything is going on right now. There's a lot of distractions, and I think we're going to see a lot more pockets, especially in the States. I'm thinking the next week or two, they're going to have a huge spike in cases. They're already up to 100,000. And if they continue the cases that they saw in the first wave, by September, they're going to be up to 200,000. So it's a very different world and very different variables. But I think the virus and just the natural sociological events that happen when something like this does, that doesn't change.
Maintaining discipline and staying disciplined, fatigue wears in, people eventually want to drop their guard, and it's psychologically taxing.
It is.
I wonder if there's not just this point where people just want to think that it's going to be okay. Maybe they don't know anyone that's been diagnosed as with COVID-19, and it's easy to drop your guard and say, well, the weather's nice, I've had enough of this, it doesn't seem to be a problem, it hasn't touched me personally, therefore I'm going to relax. And this is where we could get into trouble. Would you agree?
I think so. And they're talking about in the news when the levels peak in the US, I think people are just so over it. They're just so over COVID. It's been there. They've already been through the fear factor of it. And their guards are relaxed. And if they hear that another 100,000 people have died, I don't think that the psychological impact is going to be the same as when the first 100,000 people died.
Right. So we get numb to it after a while, and we don't really pay attention anymore. It doesn't shock us or surprise us, and it just becomes part of life. Is that what you're saying?
I think so.
Right, exactly. So, what is your take on the future? I mean, from your perspective as a microbiologist, having experience in standing up these responses, if you were to look into your crystal ball, and I know that's a bit of an unfair question because we're learning so much on an ongoing basis, and this really could go absolutely anywhere. What is your intuition based on your experience telling you as to where this could all go in the next while?
I'm very optimistic. I think that we really needed a global reset on a number of levels, and I think this is going to bring change. And I'm really hoping optimistically that it's going to bring change that's positive to our economy, positive to our society. We're going to go through a little bit of tough times here in the next couple of years, but I think just seeing what you saw with COVID and that really exponential level of innovation, it's just mind-blowing. Like, you have a healthcare system that's saying, listen, we need help, you need to flatten the curve, and we need to have more capacity to be able to deal with the number of patients we're typically going to see in the next couple weeks. So you have brewers that are producing hand sanitizers, fashion makers making PPE. I even read somewhere that they're turning CPAP machines into ventilators. And like, we haven't seen a collective effort like this since World War II, and it's pretty fantastic how everybody's coming together despite some of the political rocks that have been thrown here and there. I think globally we're doing a really good job.
So, in amongst the hardship, and it's easy to criticize, of course, what you're saying is there's a lot of positivity, there's a lot of good happening here as well.
There is, and I believe too. In cross innovation and having different subject matter experts learning how to translate their knowledge across platforms and having liaisons to tell somebody who's really good in science and somebody who's really good in technology, hey, let's bring you guys together and come up with a collective idea that nobody has ever seen before. And that's what we're seeing happen here. You're getting a lot more open innovation. The business continuities are changing, org charts in hospitals are changing, pandemic plans are changing, communications rapidly changing. There's going to be so many lessons learned from this. I can see a lot of good coming from it.
And maybe we're all learning to appreciate our essential services just a little bit more
Yes,
and the more mundane things.
absolutely.
We
Mhm.
do have a question here, and if anyone does have a question, please feel free to ask the question via the chat feature or via the question and answer feature here on Zoom as well. But Tom asks, early on in the pandemic, I believe the COVID virus was genome identified, and it was said to have given an advantage for finding a vaccine. Given that the virus could be manipulated for economic or geopolitical advantage, has the virus been independently typed, or is that difficult because it is constantly changing?
So has the virus been independently typed? So is he meaning, can you explain the question? Is he meaning, was it man-made or?
I think the question is, has the virus been independently typed, or is that difficult because it's constantly changing? So maybe tell us a little bit about first of all, for a guy like myself who doesn't really know much about this, what is genome identification to start with? And how does that help us once we identify the unique genome that makes up the virus?
Well, with coronavirus, a lot different from influenza. Influenza has a bunch of segments that can kind of cross over with other segments. So there's so much manipulation on a genetic level that it's really hard to get a vaccine going. With coronavirus, it's a typical RNA strand, and it does not change too much. I mean, there's the only areas of change on an evolutionary level are small genetic mutations. So from when I believe we received the genome from China in January, there have been small mutations, and I'm not too sure if anything's been proven that it's affected transmission or mortality rates. But I do know that there's only a certain piece of the genome that scientists are interested in manipulating, or let's say cutting out, to be able to inject into a human to create an immune response. The rest of the genome really doesn't matter unless they see a difference in infectious rate.
Right.
So I think, yeah, there's not much change. And it's not changing like influenza would change. It's just, I think with respect to vaccines, what's happening is there's a lot of different types of vaccines, a lot of innovative vaccines. Back when vaccines were first invented, the typical way would be to inject a viral protein into the body using some sort of adjuvant, and then naturally your body would make an immune response to this antigen. Well, now they're finding different ways to inject DNA or perhaps RNA, messenger RNA, into your body, and it will find its way into your own cell, and your own cell will produce, with its own machinery, the viral protein, kick it out, and then your body is going to make an immune response from that. So there's a bunch of different methods, and they're trying to find the safest, most efficient, and fastest way to manufacture.
So we're seeing a number of different sort of channels, if you will, some pathways to actually achieving this vaccine. We do hear that a vaccine typically takes about 2 years, and this is taking significantly less time, I guess, because of the urgency associated with this. What are some of the more innovative vaccines that you're hearing about, or methodologies?
Well, it would be the recombinant vaccines that actually our own cells will produce the antigen and spit it out and create an immune response. Those are very different from what I've seen or what I've studied in the past. Some other vaccines you hear that are bacterial vaccines, they will actually either put a live attenuated virus in your body, which means it's a live virus. It's the exact same virus that virus or bacteria that you would catch, but it's attenuated in a way that it's not going to cause disease or infection, but it will cause an immune response. And then other vaccines, you'd have different pieces or different segments of the virus or bacteria or pathogen injected in your body that we know the body already recognizes as an antigen. And now we're seeing novel ways to create vaccines. And there's so much that goes into this. It's manufacturing, it's preservation, it's, does one need to be kept at 4 degrees and the other one can be kept at room temperature? Efficacy, how long is it going to last, which we will never know until we start the process. Safety, and how fast we can get it out on the market. Now, it's going really fast right now because a lot of these vaccines are in clinical trial. So they've gone past the mouse, the rabbit, and the non-human primate stage, and they're going into human clinical trials. Now, there's so much collaboration and so many people are doing this at the same time that they're actually doing all these tests in parallel. So what vaccination production takes about 2 years is being the same amount of work is being done in 2 months. So it's pretty exceptional.
Will there be innovation? And we sort of used the analogy of World War II earlier on, and the huge amount of innovation that occurred during that sort of 6-year period. Is there innovation being developed here, innovative techniques that will benefit other areas of medical science as well?
Yeah, absolutely. We're going to get a lot of lessons learned from this. And I feel like to even not so much the scientific community, because there'll be a lot of publications and there'll be so much new knowledge on how a coronavirus actually works. But I feel like the healthcare, continuity of healthcare in first world countries is going to be completely reorganized. And we're going to be able to coordinate business continuity. We're going to be able to make sure we have the appropriate resources if something like this happens again. There's going to be more cross-training. There's going to be, I think, more awareness. And I just think that there's going to be a huge shift in making the medical and healthcare field a lot more efficient, a lot more faster response than we've seen.
Perfect. We are out of time, Chelsey, but I'd really like to thank you, Chelsey Goodman, microbiologist, formerly with the Public Health Canada Microbiology Lab in Winnipeg, and now an open source professional yourself. I'd like to thank you for taking the time to be here today and actually leaving us with that very positive note as well, that out of all of this, there will eventually be some positive change. So Chelsey, thank you very much for taking the time to be here today.
Thanks for having me, Dave.
And for those of you joining us on YouTube, and for those of you in during this webinar as well, we do hope you're going to join us for future episodes of Drop In and Learn. Please visit us at dropinandlearn.org. Thank you very much.